10 First Aid Techniques that could save your life. When someone is injured, every second counts. So, here are 10 first aid techniques that could save your life in an emergency. There are some instances where an emergency requires the quick action of a bystander to save a life. You may already know cardiopulmonary resuscitation (CPR), which is probably among the first lifesavers people think of for people with no heartbeat or no breathing. But there are several other practical first aid techniques that can also make a real difference in a medical crisis. First of all, stay calm and always ensure your own safety, especially if you're on a hazardous scene like a fire, natural disaster, or traffic accident. Be aware of your surroundings and prioritize your well-being. If the person is drunk or drug-affected, approach with caution. Universal precautions to protect yourself also include personal protective equipment, such as latex-free gloves and eye protection. Assign a bystander to call 911 before you start your first aid. Then, react quickly and confidently to save the day. Here are 10 easy-to-learn techniques everyone, even those with limited or no medical training, should learn. Number 1. What to do in case of a choking hazard. The first thing to do when somebody is choking on a piece of food is to give 5 and 5. Get behind the person and give 5 blows to the person's back with the heel of your hand. This could dislodge the food and clear the airway obstruction. If that doesn't work and choking continues, it's time to try abdominal thrusts. This is called the Heimlich maneuver. Give 5 inward and upward abdominal thrusts by holding your hands between the navel and lower rib cage. Repeat the cycle of 5 back blows, then 5 Heimlich thrusts until the person coughs out the object. You can even give yourself the Heimlich maneuver if you are choking and there isn't anyone around by using a chair or counter to provide the thrusts instead of your hands. Choking can cause irreversible brain death in as little as 10 minutes. So, don't delay in taking action. Number 2. What if an injured person is bleeding? If someone near you has been injured and is bleeding, you will need to act quickly. Almost all external bleeding can be stopped by direct pressure and elevation. First, use a sterile pad or clean cloth and apply firm pressure to the wound until the bleeding stops. You can even purchase bandages that have a blood clotting agent on them, a good first aid kit item to have. Never remove any bandages to check on the wound as the bleeding could resume or get worse. Next, elevate the wound above the heart. Doing so will help reduce the chance of the bleeding. Let first responders provide more advanced medical care if the bleeding does not stop. Number 3. How to instantly manage low blood sugar. Diabetes is a medical condition that affects blood sugar levels. Blood sugar levels can drop abnormally low, especially when diabetics miss a meal or exercise too much, resulting in a condition called hypoglycemia. Severely low blood sugar levels could lead to a coma or could even be fatal. Symptoms include extreme tiredness and loss of concentration, rapid onset of confusion, rapid pulse, shallow breathing, general weakness, and pale, clammy skin. While not every symptom may be present, the person needs emergency first aid. Always call for urgent help if the person is unresponsive. You can help the person to sit on a chair or the floor if they feel faint. If they are conscious, give them fruit juice, glucose, or a sweetened drink or food to raise their blood sugar levels. Improvement is usually obvious within minutes. Ask whether they have a glucometer to test their blood glucose level. Number 4. What to do when someone suffers from acute burns? Superficial burns such as scalds or sunburns are common. Don't use ice. Run cool, tap water over the affected skin for at least 10 minutes. Next, use a moist compress to cool the skin. Cover the burn loosely with sterile, non-adhesive material like gauze. Don't apply butter or ointments to a burn. These can cause serious infection. Don't break blisters. Provide an over-the-counter pain medicine if needed. Severe burns are deep or extensive, measuring larger than 3 inches and require emergency medical care ASAP. Number 5. What to do when someone has a heart attack? In a heart attack, blood cells and platelets form a clot that blocks blood flow, causing an unsafe lack of oxygen to the heart. In as little as 5 minutes, aspirin given to a suspected heart attack victim can prevent this clot formation. If you think someone is having a heart attack, call emergency responders first. If the person isn't allergic to aspirin or hasn't been told to avoid it, let the responders guide you as to whether aspirin could help. Ask the person to chew the pill, as chewing helps the body absorb the pill more quickly than swallowing the pill whole. Number 6. What to do when someone is having seizures? The first and most important thing to do is to keep the person safe until the seizure stops on its own. Clear the area of hazards, loosen anything around the person's neck, and gently roll them onto their side. Use a blanket or folded clothes to cushion and protect their heads from injury and remove their eyeglasses. Don't put anything in their mouth, grab their hand, or restrain the person in any way. Look for a medical alert ID on a bracelet or necklace to see if they are epileptic or have any seizure disorder identifiers. Time the seizure and call an ambulance if the seizure lasts more than 5 minutes or if the person remains unresponsive for more than 5 minutes after the seizure stops. Number 7. What do you do if you develop a sprain? If someone rolls an ankle or twists a knee, just remember to follow the tried and true RICE method. It's super simple support for minor strains or sprains, and everyone can do it. Let's break down the RICE. R equals rest. Support the injured limb in a comfortable position. I equals ice. Use an ice bag or even frozen veggies to reduce pain and swelling. C equals compression. Wrap a sprained joint, like an ankle, knee, or elbow, with an elastic bandage to support the injured area and prevent swelling. Make sure the wrap feels comfortable and isn't too tight so circulation isn't cut off. E equals elevate. Help the person limit swelling and bruising by having them lay down and use pillows, blankets, or clothing to keep the injured part elevated. Number 8. What do you do for a frostbite? Frostbite is a condition where prolonged exposure to cold weather can cause the tissue below the skin to freeze. Frostbite commonly involves fingers, toes, feet, ears, or the nose. Move the victim to a warm area indoors as soon as possible. Remove any wet or frozen clothing. Wrap the person in blankets or place them in a tub of warm water, but avoid hot water. If the person is conscious and alert, give them hot liquids to drink, but not alcohol. Call for emergency help if the skin changes color or becomes hard, the skin stays numb, the person has severe pain as their skin thaws, or if skin blisters appear. Number 9. How does one manage a heat exhaustion victim? When excessive heat affects a person, confusion, a weak pulse rate, and rapid, shallow breathing can set in suddenly or over a period of time. Usually, it happens after working or playing in excessive heat, perspiring heavily, or after becoming dehydrated. First, get the person out of the heat and into a cool, shaded, or air-conditioned area to rest. Have the person lie down and elevate his or her feet, apply a cool compress, and fan them. Give them plenty of water or other non-alcoholic beverages for rehydration. If possible, have them take a cool bath, shower, or sponge bath. Seek emergency help if the symptoms get worse or last more than an hour, or if the person is nauseated or vomiting. Number 10. How do you aid a person in shock? If you suspect a person is in shock, call for emergency responders first because untreated shock can lead to organ damage or even death. Try to control any external bleeding. If possible, have the person lie down and raise their feet. Keep the person still, at a normal temperature, and stay with them until help arrives. Don't let the person eat or drink anything. Those were the 10 first aid techniques that might save your life someday. I hope you liked the emergency tips in this video. I am sure these 10 techniques will help you in saving your life, or better still, many other lives. Always remember to call emergency and summon professional help whenever needed. And, more importantly, don't panic. A professional on the line can guide you through how to provide life-saving care to a victim of an injury, illness, or other emergencies. If you have not subscribed to my YouTube channel, click on the thumbs up and subscribe buttons. Remember also to click the bell icon to get regular updates. For more health content like this, visit www.medicalisland.net.